Hey, well, good morning, everybody. We're here from the British Association of Dermatologists meeting, and we're here with the BSF, the British Skin Foundation, and all of you guys. And it is a real pleasure to be here from Liverpool. What is not to like about Liverpool? Liverpool is such a cool place. It's actually where I'm from. My name is Tony Bewley, and I'm a consultant dermatologist over in London. Now, to celebrate the launch of Skin Below the Surface, a new collaborative program by ITN Business and the British Skin Foundation, we brought together 5 experts to discuss the impact of skin condition and skin diseases on emotional well-being and mental health. So I'm going to introduce in a moment my 5 colleagues. But the British Skin Foundation, the BSF, recognises the importance of psychodermatology, and all of us in this panel, and thankfully the BSF, the British Skin Foundation, are very aware of the importance of psychodermatology. And we're here really to try and talk and to push the momentum about the idea that it's not just about skin, it's also about the person underneath the skin. It's also about what it's like to be in that skin and how it feels to be in that skin and how we behave in that skin when the skin can have changes. Okay, so I'm going to start on my left with Dr. Bernard Ho.
Hello, I'm one of the dermatologists, one of the consultant dermatologists in South London.
And my name is Tony Bewley. I'm a dermatologist in London too.
Hi, morning everyone. I'm Eleanor Chatburn. I'm a clinical psychologist at South London.
And hi, I'm Tess McPherson. I'm a consultant dermatologist in Oxford, and I'm currently president for the British Society for Paediatric and Adolescent Dermatology.
And online, we should have Dr. Anjali Mahto, who is also a consultant dermatologist, and we're trying to find where she is so she can pop up on your screens like the wonderful person that she is. Now, okay, so I'm going to start off by asking some questions, and we have about 45 minutes of questions and answers via this panel chat. And then we're going to go into the program which has been developed by the ITN together with the British Skin Foundation. So what does psychodermatology mean to you and the patients that you see? Tess, can I start with you? Is that okay?
Of course. So psychodermatology, I think, as you introduced, Tony, is the link between the mind, the person and their skin, and it's completely it's integral. I mean, we are one being, and how our skin is, how our skin's behaving, the uncertainty of our skin and what it looks like, what it feels like, has an impact on how we feel, and how we feel also has an impact on the skin that we have. So it works both ways.
Eleanor, do you have any comments about this?
I think for me, it's about taking a multidisciplinary perspective, that as with any, chronic medical condition, a skin condition, like Tess said, affects all aspects of your well-being, your emotional state, your psychological state, your social life, your work life, your school life. It's really across the board. And that's why for me as a clinical psychologist, I see the value in having lots of professionals coming together to think about the impact of a skin condition on all aspects of someone's life.
And tell me more about the whole multidisciplinary team approach, because that's really important that we have psychologists, primary care doctors, pediatricians, psychiatrists involved. Tell me more about that. Tell me more about your role.
I think it's having professionals who bring a range of perspectives and areas of expertise where you can then come together to think holistically about someone. So, for example, if someone has heavily restricted their diet, maybe they'd benefit from seeing a registered dietitian. If someone's mental health has been really impacted, maybe they would benefit from some individual therapy or support from a trained mental health clinician. And having that kind of holistic 360-degree view, I think, is just so important with skin conditions.
So it's not unusual in the psychodermatology clinics to have a dermatology healthcare professional who happens to be a doctor together with a psychologist, either in the same room or in a room nearby. Is that right?
So in some NHS clinics, you could actually come in and see a number of professionals almost in one clinic.
Yeah.
Some clinics are psychiatrist led. So a psychiatrist is a medical doctor who specializes in mental health, and they can also prescribe medications, which some people may benefit from.
Yeah.
And there also may be a clinical psychologist, someone like me who's not medically trained, but has holistic training in mental health. So you could see a range of different professionals in an NHS psychodermatology
Can I just
clinic.
say one thing in answer to that? I mean, I think that is obviously the gold standard, and that's amazing, and that is what patients would do benefit from, that multidisciplinary approach. But I think it's really important to remember that all of us have the skills, all health workers have the skills and have to have the skills to see people as whole people.
Yes.
And you don't want to be too siloed, and many people do not have the luxury of having, dietitians, psychologists within their service, and that shouldn't stop them approaching people, particularly young people, as and considering all the aspects on their health, and just being able to listen, being able to appreciate the emotional impact of a skin disease. I think that's something we all need to do, even if you don't have the full MDT available to you.
Yeah, it's a really important point. And Bernard, I was going to ask you about that. So if a patient comes to see one of us in psychodermatology or in dermatology and feels shortchanged or not taken seriously, how do we empower that patient to say, you need to ask for more, you need to request more from your consultation?
So I think part of it is giving them that space to listen and helping them come up with that list of things that is their concern. And I think by having the active dialogue with the patient and the carers or parents is knowing that what are the actual concerns that we can actually address in that clinic, in that consultation, and what's realistic, because 10, 15 minutes, I have a bit longer in my skin and mind clinic, but realistically, in 10, 15 minutes, you can only address a certain number. And then signposting, and I think as healthcare professionals, is knowing what your local resources are. And if you don't know it, find out from relevant patient support groups, national groups, such as British Skin Foundation, to help signpost you to things that may be relevant for that patient, for their physical health and or mental health. But there's, I think, an untapped resource that we have is a lot of, like Mind UK, for example, have a lot of great self-help guides. So in one sense, it's not recreating what's been created already, but more signposting patients to available material, which will then signpost them to further help if they need it. Right.
Now, Eleanor, I want to talk a little bit as well, because some patients come to a clinic and they see a psychologist or a psychiatrist and they say, but I haven't got mental health disease. How do we deconstruct that stigma about mental health and about looking after ourselves holistically?
I think you're absolutely right to think about this idea of, is it mental illness, or is it actually a normal and understandable reaction and response to dealing with something that really impacts all aspects of your life? It's very stressful to live with a skin condition. It's very burdensome. If you think of the number of appointments you have to go to, creams, medications, it's physically, emotionally, financially burdensome. And it may be that your skin disease affects your physical appearance. So there's a degree of social stigma. Often people feel, anxious in social situations. So that can look like social anxiety. If you feel very hopeless about your skin, then that can look like depression. But sometimes using these terms like depression, social anxiety disorder isn't always so helpful. For some people, it can be that you talk with a psychiatrist and they feel that could be helpful. But for a lot of people, I try and just use normalizing language, that this is an understandable response, and let's see how we can support you with your wider well-being.
And I would say that I think it has become a little bit, it's more normal for all people to have been more in touch with their mental health. And I think there is a sort of an understanding that everyone is dealing with mental health conditions and how the skin might impact on that. And I like you said, it's sort of normalizing it. It's accepting that these things will happen, with or without a skin problem, and how skin problems can make this so much worse, and how they can specifically impact on yourself, how you feel about yourself and how you feel you interact with society.
And certainly in my clinic, where we do have dermatologists and psychiatrists and psychologists either in the same room or nearby, there's been over 20 years now, there's been hardly any, maybe 2 patients where the patient has said, I don't want to have the psychologist or I don't want to have the psychiatrist in the room. So the vast majority of patients said, okay, I get that there's a psychiatrist or a psychologist in the room. Let's see where that goes. And then afterwards, they've been really grateful for the input from a multidisciplinary team, from the psychologist being around. And then they've fed back to us, thank goodness that person was there, because I've seen other healthcare professionals and I haven't felt listened to. And yet when I come to this particular service, then I have felt a bit more listened to, which goes back to your point, though, Tess, about we are all of us able to run this.
I have a psychologist in a separate room, and I think even that, and I just say when in my adolescent clinic, it's completely normal for your skin to impact how you feel. And it's really important we address and support that as well. So the psychologist is there. They will always see them when they first come to the clinic, but then it's accessible as they need, and making it something which they can access on an as need or just a check-in basis, I think can really normalise that. And that was one of the reasons that, as in your service, I wanted to have it as a normal part of their dermatology sort of service.
Sure. Now, I'm conscious that we haven't involved Anjali, and do we have Anjali online? I'm not sure we do. So I'm going to turn over to Bernard and say a little bit. Can you tell us more about here we go, we've got Anjali online. Anjali, tell us a little bit about setting up your psychodermatology service and what that felt like, if you could, please.
Yeah, absolutely. I'm sorry I haven't joined sooner. We've been having some tech issues, but I've been listening to everything you've all said. And so much of what we do isn't just about getting our patient to look good. It's about getting them to feel good in their skin as well. And that's why I think this MDT approach everyone has touched on is so important. I think when I came to setting up the clinic, it was very, very clear that there is only so much a dermatologist can do in improving a patient and their skin and their life and their journey. And having the input of a clinical psychologist is absolutely vital to getting people to live their best lives. And that's why I'm very lucky to have Eleanor as well as a colleague who has the experience in body image. Because I think that skin is the bit that we don't talk about in body image. We talk a lot about weight these days, but skin often gets left behind and is missed out in this journey.
Very good. Thank you. Now, I wanted to talk a little bit about the link between the skin and the brain, or the skin and the mind. And Bernard, I was going to talk to you a little bit about this. Tell us a little bit more about how the brain connects to the skin.
So, in many ways. So I think at a physiological level, we know that some of the hormones and protein that's involved at a central nervous system, peripheral nervous system, and the skin are all linked, and the signaling between them are all connected. And then you add in the gut, you add in stress. All of these are using the same modulators, and we're learning more and more about it. And then you add on outside of the self, the body self, you then have your triggers, be it your environmental, your emotional triggers, environmental triggers. All of this can play a role in and how it affects the physiological state. And that's where I think the skin and mind is linked, but in more ways than we're able to understand at the moment with the current ways of measuring things. So yeah, I think without being too cerebral about it, we are all part of the system and the system affects us. But getting very meta with this.
Thank you very much. Okay, so what should people do if somebody is really struggling with how they're coping with their skin? What should they do? How should they approach? What services can they approach, and how should they empower themselves to navigate through whatever systems are available?
I think the key thing is to find a health professional who you trust and who you feel you can talk to. Now, some people their skin condition is managed by their GP. So I'd hope that you'd feel comfortable in going to your GP and saying, look, actually, my skin is really getting in the way of me living my life. It's impacting my quality of life. If you're under the care of a dermatologist, then try and raise it with them. I know some people, find it hard to access support, in which case I'd really encourage people to look at the fantastic resources that have been created by the British Skin Foundation, but also have a look at some of the mental health charities such as Mind. And there are some kind of self-help approaches you can use, such as managing stress management strategies, managing feelings of anxiety. If you're feeling that your activity levels have gone down, you're not getting out the house much, approaches to managing kind of low mood actually can be really helpful. And actually, I'd say to people, don't overlook the mental health services that you can access through your GP or you can self-refer to across England. These are routes that you can go straight in. But I would say some people may benefit from a more specialist approach.
Right.
And that's there when you might be thinking about asking, is there a psychodermatology service in my local NHS trust that I can access? The problem we have is it is not a universal service model. It's a bit of a postcode lottery at the moment. Lots of us are trying to campaign to improve provision and access. So I'd say make the most of charities, support groups. There is lots out there. And I know the British Skin Foundation are doing a really big focus on skin and mind this year. So do have a look on their website where they're pulling together lots of information so you can know where best to go for help.
That's right. So the BSF certainly are very helpful and their website is very helpful. And then the British Association of Dermatologists Patient Hub, which is skinhealthinfo.org.uk, can also be quite helpful, can't it, for patients?
Can I tag on this bit about, because we talked about using the biopsychosocial model, you know, as healthcare professionals. I think we've talked about the biology, the psychology of it, but the social aspects of it, I think it's engaging with the primary care.
Right.
And getting them, there's social prescribers and link prescribers out there to help link patients to their social environment.
Yeah.
So things like loneliness, they can link them to befriending services. They can link them to community groups that can help support our service users and patients in their own communities, and tailoring it, because I don't know all the resources within my, you know, many councils, and the library. The library is a great source of information, and I think we underutilize free to access places like the library. So highly recommend going to your local library.
And I would just add the BSPAD. We've redone our website, links to BSF, links to BAD, but also links to lots of appropriate sort of good resources for young people in terms of supporting skin and mind. And
BSPAD stands for
British Society for Paediatric and Adolescent Dermatology.
And is there a website?
Yes, we've got a new website, bspad.co.uk, and that's an affiliated special interest group to the British Association of Dermatology.
Very good. Now, Eleanor, I think some patients like to access some techniques online, like mindfulness and relaxation techniques. Is that right? Is that useful?
Oh, these are such powerful techniques. Anything that you can do to help to manage stress in the body, because as we've been talking about, this link between the brain and the skin is so fundamental. So managing stress can really help. So if it's, you know, guided muscle relaxation, deep breathing, mindfulness, incorporating more self-care into your bedtime routine, whatever it is that just gives you time just to kind of collect yourself and check in on how things are for you and tune into the present moment, because I think often we get quite caught up in our heads and we're quite busy with self-critical thoughts often. And it can be hard to get some respite from this, you know, burden that we've been talking about, the burden of managing a skin condition, to almost giving yourself permission to nourish yourself. And that's just as important part as putting on your creams and taking your medications.
Can I just say one thing? I think that a lot of my patients will feel that self-critical thing will feed in, and they feel that they are more stressed and they handle stress badly. And I think that also needs to be debunked, because skin conditions happen. It's not your fault. They happen. They're common. And I think young people, all people, need to understand that it's not their fault. And it's not because they're a stressed person or an anxious person. All these things play a role and can become kind of into cycles. But I think they need to hear from the health professionals and from the psychological support that this isn't because they're a bad person, because they will harbour those faults. And they will feel that it's their fault, and they need to know that the stress is not their fault as well, and it's not because they're stressed, mentally unstable people.
And there is a growing recognition that self-compassion is really important, really crucial. Eleanor,
and just to say on the self-compassion, it can really help with these shameful, negative thoughts. That it's a really lovely method where you acknowledge that this is a moment of suffering. This is difficult, and then you remind yourself, other people in this situation would also struggle.
Absolutely.
And then you offer yourself some kindness.
Yeah.
And what that does is it accepts the situation it is. And we're not trying to say you don't have, you know, skin problems. We're acknowledging the reality of that, and that you're doing your very best in a really difficult situation.
I wanted to also briefly mention the whole idea of IAPT, the improving access to psychological therapies, because some patients can self-refer in various places around the UK, can't they?
Yes, definitely. I think IAPT got renamed, improving access to psychological therapies for anxiety and depression. But basically, as you said, it is the way that you can self-refer and see a practitioner. If you're unsure, you can talk to your GP, but there are self-referral routes. And these are the sort of skills-based approaches where you could learn kind of coping strategies and techniques for managing feelings of anxiety, or if you're feeling low. Like I say, it's not for everyone. Some people might need a little bit more than that. They might want something personalized to them, but it can be a good starting place.
Yeah, and I think for some young people, some of these more timely sort of techniques don't suit them. They don't, you know, I mean, mindfulness can be very good for some people, but it doesn't work for other people. So I think it's finding techniques that will make you feel good in your body and in your skin, again, quite personal.
Sure. And Anjali, I wanted to talk a little bit about what happens if a patient is feeling, or an individual is feeling really desperate right now. You know, they're feeling that actually they've had enough, and they want, you know, they want the pain to stop. What do we do? How do we manage that? How can we signpost patients when they're feeling at crisis point?
Yeah, so I think the important things here are, firstly, it's being honest and transparent about how you're feeling. And if this is a young person, it's making sure that friends and family are keeping an eye on what's going on, looking out for behavioral change. Is somebody becoming socially isolated? Are they suddenly stopping doing the things they want to be able to do? And if somebody is feeling that they are suffering and they've got nowhere to go, it is incredibly important to seek help.
Yes.
First line of help would probably be your NHS GP that you would go and approach. I'm fully aware access is difficult, but it's important that people let others know if they're struggling, because that has to be opening up the gateway and the conversation. The second thing, actually, just to touch slightly on as well, what everyone's been saying about not blaming oneself for a skin issue. I think one of the big problems, certainly, that we see in a lot of the younger people is with social media use. There is this idea and this narrative that's being pushed that you are what you eat, or your skin is a reflection of what you're putting into your body. And I think a lot of people end up feeling then that we're losing the multifactorialness of skin disease itself, and people are thinking, I am doing something wrong and I have done this to myself, which is why my skin is looking this way. So I think it sounds silly, but the other thing I would say is it's that human connection, that stepping away from social media, unfollowing accounts that aren't serving you well, and actually reaching out to your real connections, which are your friends, your family, so they are able to get you the help that you need if you are feeling in a position where you're unable to do so.
Tess, did you want to add anything to that?
Yeah, I mean, I think social media it's definitely got some negatives, and as Anjali says, there is this sort of myth that good skin, perfect skin reflects, you know, other characteristics. I think that is being challenged, and I think that is being helpfully challenged. And I know increasingly, you know, particularly young people can be empowered by showing their skin, sharing their stories, and that can help other young people. And there are certainly other resources such as Health Talk, which can share that. But as Anjali says, it can be a very negative, and it can lead to people feeling increasingly bad about the way they look, and that it must be their fault. And it's about establishing real, authentic connections and using social media for its more positive aspects, which there certainly are. And there is more challenge to this myth, but still it's sustained.
I think partly the difficulty is the fact the algorithms are created that the more you engage with it, the more you're going to get that negative feedback.
Absolutely.
Yeah. So I think your tip on unfollowing it definitely helps, but it's encouraging our service users or the general public to start disengaging with those material, because we know that the professional materials that are out there are less engaged than the emotive ones, the one that talk about the diet, the one that talk about things are in your control.
Or miracle cures.
Yeah, I've heard the Newton third law being used. With every action, there's a reaction, and somehow tying that to food allergies. And you're like, how does that work? But they made it work. It doesn't make sense if you really think about it. But Yeah. But I think at the really extreme end, I think some of these negative thoughts can become very intrusive, leading to active suicidal thoughts and ideation. And I think there is Samaritans. Samaritans is a great hotline, and they can help. They could be a good first line. But if you're having any active plans, I think A&E, and not just wait for your GP. I think going to A&E would be, or calling 999.
Yeah, and there is a crisis team in every A&E department, isn't there, that you can access if you're feeling really you've had enough right here, right now. So, it's important to flag that up. Now, I wanted to talk a little bit about some of the questions that we've had from the audience. These are often fairly specific cases. So one of the questions was, my 4-month-old child has extremely bad eczema and is obviously uncomfortable and unhappy. I don't know how to make things better for him. He cries a lot, which affects my 4-year-old, especially at nighttime. I'm tired and constantly feel guilty. It's having an impact on the whole family. Do you have any advice, Tess?
Absolutely. I mean, this just demonstrates how one member of the family with significant skin condition can impact the whole family, and sleep is massive, isn't it? I mean, the thing about psychodermatology is the psycho, but the dermatology, and it sounds like here the most important thing is to get some good treatment for that baby's eczema, and there are effective treatments, and your GP can provide them. There's good guidance if you need dermatology advice, but really it's about reducing the inflammation in the skin so the baby is less itchy, more comfortable. And although there are good treatments to manage and control eczema, and that's where I'd start with that, because once you can reduce the inflammatory eczema, reduce the itch, get some sleep back, then hopefully the whole thing could be a bit of a cycle. And it's normal to feel guilty, and if you're tired, you're going to feel worse. So it's, again, it's back to that point that it's nobody's fault. People get eczema, people get skin disease. There are treatments. You need to access some treatments to improve the skin.
And Eleanor, how do we deconstruct that sense of guilt that families and carers can build up? We're talking a little bit about self-compassion in a moment.
Absolutely. As Tess has said, it's actually really normal, unfortunately, that parents and carers can feel guilty, can feel blamed, can think, I'm not doing enough, I could do more, and really internalize that. And the research has borne that out, actually, that parents of young children with skin conditions, they are more stressed, and that there's an impact, as you've said in your question there, actually on the whole family's quality of life and well-being. But I think it comes back to being kind to yourself. Actually, in that moment, we've talked about this idea of self-compassion and just naming what's going on for you and reminding yourself in a gentle, compassionate way, I'm doing my best. I'm being the best, mum I could be.
It's tough being a mum of any baby, but a baby with eczema is it can feel really difficult.
And I'm doing really well.
You're doing really well.
Yeah. It's hard work being a parent without layering on.
And you'll have many people that will tell you unhelpful things about things you could do or things you may have done
because they've seen on social media.
Yeah, exactly. And it's just stripping that back, managing the eczema, and being kind to yourself.
Yeah. Usually if you can identify and say, why am I feeling so guilty about this? That can sometimes dispel some of those. Do you think, Eleanor?
And I think, like we say, you get unhelpful comments, right, from people who don't know what it's like to be a parent of a child with a chronic skin condition. And that's why I'd really recommend connecting with charities. There are some great charities out there who specifically support parents, where you can talk with someone who gets it.
Yeah, absolutely.
And other parents can sometimes get. So, for example, in that case, National Eczema Society, they have great support groups.
Yeah, absolutely.
Eczema outreach, which you were just involved in.
Yes. The youth panel are talking downstairs about social media right now.
Okay, I'm going to move on to another question from one of the people in the audience, and this is for you, Anjali, if that's okay. One of our colleagues says, I have acne across my chest and back, and it makes me feel very self-conscious, especially when I'm going out on dates or being intimate with a new partner. What can I do about that?
Yeah, and I think this is a really common scenario that's encountered, sort of dating life being, affected by chronic inflammatory skin conditions. So in terms of general things that can be done, I think the first thing is recognizing it's okay to feel that way, and it's not unusual to feel that way. The second thing is trying to get the skin disease itself under some degree of control. So that may be seeking help from a GP or a dermatologist. So there are measures in place to actually bring the active issue itself to a place where you feel comfortable about it. But then I think after that, it's also, again, about looking after your own mental health. It's about the self-care aspect of all of this. It's making sure that your self-esteem isn't purely coming from what you look like. So it's eating well, it's moving well, it's sleeping well, all of those things that are incredibly important that make us who we are. In addition to that, again, I think a lot of this is about your offline connections, not your online connections. It's your network, it's your friends, your family that essentially validate, give you self-esteem, and not that skin condition that defines who you are. And then the final thing, if possible, and I know this is not accessible to everyone. I mean, I would put everybody into therapy if I could, but getting that clinical psychology input, if it's possible, if your skin condition is limiting you on a day-to-day basis with things like dating.
Yes, it's interesting. So in psychodermatology, we often talk about two things, don't we? But the myths of psychodermatology. And the first myth is that if you have a lot of skin disease, you're going to have a lot of psychosocial stuff going on. And it's a myth. You can have quite limited skin disease and feel pretty dreadful, or you can have quite extensive skin disease and actually cope pretty well. And it doesn't matter the extent of the skin disease. It matters the impact that has on the individual, doesn't it? So that's the first myth. And the second myth, and this case or this patient, really illustrates that for us, is that if it's underneath the skin, so it's on your back or hidden under clothes, that somehow that doesn't matter anywhere near as much as if it's on your face or on your hands. And that's not the case. We know from lots and lots and lots of individuals that if it's underneath your skin, or if it's underneath your clothes, should I say, that can matter just as much as if it's on your face.
Just as much. I mean, I've got one patient with psoriasis who calls her psoriasis her dirty little secret, and keeps herself completely covered up, which is just such a tragic thing. And I think, as Anjali was saying, it's important to remember you do have some control over that impact, and that is something that feels unsurmountable, but it is something that with the right support, with the right help, you can manage that impact, and you can empower yourself to manage that impact well. Yeah.
And Bernard, we always talk about in psychodermatology, kind of the golden rule of psychodermatology is to treat the skin and whatever's going on inside at the same time. And this particular person is struggling with the skin changes, following acne, but also about how that feels to live in that body that's got those skin changes. Can you talk us a little bit more about treating the skin and how you're feeling at the same time?
So I think it's contextualizing the feelings of the patient and what the social, I like the social context, because I think we often forget that within our consultation is what world are they living in, and how their skin condition impacts them in their environment. I think particularly with the marginalized groups, their relationship with their skin condition will differ, and it may be a lived experience that I won't be able to fully appreciate. And I think that's probably the hard bit within that consultation. And that usually takes a much longer relationship with our patients to really understand that component of it. Because even if you have treated the skin condition and their eczema is completely cured, for lack of a better word of describing controlled, I think is much better. But let's say in the hypothetical world, miraculously gone, the impact of that skin condition still exists. And I think that's where the counseling, that's where the talking therapy, that's where your social network and your chosen family is able to help support you, because that's the aftermath of it all. Even if you're, the emotional scars from your skin condition as opposed to the physical scars.
And Anjali, I wanted to come back to you. So for this particular individual that has acne scarring on his or her back, what do we do about that? How do we, because there's no such thing as perfect skin. So we need to be clear to any individual, this is what is possible in terms of getting your skin as good as we possibly can. But also we usually enter into a discussion with the individual about how much do you want me to address the issue of how you're feeling, about how you're feeling self-conscious, what's your expectations, how much do you want me to deal with that, and what do you think about engagement with online help or psychologists help and so on. I just wonder if you can guide us through that particular pathway.
Yeah, it's interesting, isn't it? Because I think as you've alluded to as well earlier, some people have got severe skin issues, but they're unbothered. Others may have a much smaller burden of skin disease, but feel very concerned about it. And when we fall into the acne scarring territory, particularly, the last thing we want to do as health professionals is give somebody a complex when they didn't have one. So I always think the starting point should be, well, does this bother you? What have you noticed? So I often say in clinic, on a scale of 1 to 10, 10 being the happiest you could be with your skin. No one ever scores their skin a 10. Where are you at? And what would get you to a good solid 7 or 8 every day? And I think that way you get the feedback from the individual of what it is that does or doesn't bother them. And I think that's got to be the starting point of the conversation, because if it doesn't bother them, we don't want to do anything at all. But if it then transpires in that conversation, well, actually, I still don't want to go swimming with my child because I've got marks on my back from the acne that I used to have. That's when you can start unpicking, well, would you consider maybe speaking to somebody? And that may also get you to a point where you can get to a point where your skin is not controlling you. And it's not, choosing and making your day-to-day decisions. You feel empowered to be able to do that. So that's how I usually tend to navigate those types of conversations. You always want to draw it out of the individual themselves and get them to tell you what it is that would make their life better.
Very good. Thank you. Now, I'm conscious of time, so we have time for just a couple more questions from the audience, one of which is, and this is for you, please, Eleanor, what's the most effective strategy for managing the emotional stress and strain of skin conditions?
I mean, that's a biggie. I think, as we've really been touching on, it's multifaceted. There isn't any one approach. I think there's things you can do yourself as an individual. So we've been talking about self-compassion, self-care, looking after yourself, but also I think a theme that's come up in the panel today is the social connection, and that we're social beings. We exist in context within communities. And I think you can also think about what are the resources around you, who is around you, who can support you. Often when I talk with patients, I ask, look, do you have any friends who've had personal experience of a skin condition? Because sometimes we have friends with the best of intentions who give unsolicited advice, and it really can be not very helpful. Finding someone you can trust, who you can talk to about and open up, I think, about what's really going on. Because I think, and it's also, I think this is where we need to work with GP colleagues, dermatology colleagues, to remind them to check in during the consultations to ask those questions. How is this impacting your quality of life? Because often what people say is, when I start to have these conversations, no one's ever asked me this.
Right.
And this is coming back to your original point, I think, about how anyone can ask these questions. It can be any health professional. Let's get these conversations going, because if we start talking about how things are, it can just really relieve the burden of the guilt, the self-blame, this sort of extra burden that we put on ourselves because of this stigma that a lot of skin conditions unfortunately carry.
But the point is, there isn't one size fits all, is there? So certainly whenever I have an individual or a patient who comes to see me, I'll talk about what's going on for them and say, look, there isn't one size fits all. These are the range of different options in terms of your skin treatment. And these are the range of different options in terms of how you're feeling and how you can best address that. And patients will choose, and usually they're okay at choosing, aren't they? Whichever option suits them the best.
Some people are, they prefer to be more active, and it could be that because they've become so self-conscious about their skin, they've dropped doing sports that they love. They've stopped going to the gym. And it could be that maybe they don't like the idea of therapy, but they'd be up for going back and re-engaging with a hobby or a sport, something that gives them joy and meaning, where also I would really encourage people to think about sports and activities where you can forget what you look like, and you can really get absorbed. Someone told me that they absolutely love whitewater rafting, because you don't get the chance to think about what you look like at all. You're trying to stay afloat.
You're focusing on something.
Whereas that person going into a gym with walls to ceiling mirrors was really triggering for them. So I think it's finding something that works for you, where you can get that joy back and that enjoyment. It's just so crucial.
And not everybody wants to see a psychologist, do they? Some people prefer to be seeing somebody one-to-one or in a group, or they prefer to do it online. So there are a range of different options that people can access, and and to build their confidence and have self-compassion.
Absolutely. And whether that is going to a charity support group,
Right.
There are a number of mental health charities that run kind of text services, online chat, telephone services, or you would like to sit down face to face with someone. I think it's finding the approach that fits you and your life circumstances.
Which is why the BSF running this program is so important, isn't it? The British Skin Foundation. So we're very pleased about that. Absolutely. Now, do we have time for any more questions? But it'll have to be very brief. Tess, briefly, what do we know about skin conditions like eczema and how they affect the well-being of people across the spectrum of different skin colours?
Well, again, that is a very large question.
Sorry.
No, it's
in
fine.
2 minutes, I'm afraid.
we know that eczema is a complex inflammatory condition, and it can affect people in different ways at different ages. And skin of colour, it can both look clinically different, and the post-inflammatory changes, so when eczema is being controlled or being managed, can be quite different depending on what your background pigment skin is. So I think that's a really important thing to recognise, that you can definitely have different, either darker or lighter skin tones when you've had inflammation in the skin, and that can be more marked in patients with skin of colour. So that's a really important thing for both patients and clinicians to recognise when they're managing.
But it can be really disfiguring, can't it?
Absolutely.
It's important not to underestimate the fact that the skin can go a bit darker, a bit lighter, or quite a lot darker, quite a lot lighter in response to skin disease. I mean, and it's dismissed by healthcare professionals.
Well, yeah, but I think it is dismissed. But I think it's reassuring.
Or it can be dismissed.
Can be dismissed. Those sorts of post-inflammatory changes will normally get better over time with skincare. So that's, but it can also look quite different. It's not always recognised by clinicians as eczema, because it can look more patchy, more, it can be quite different looks. And I guess some health professionals may not be attuned to looking at what inflammation in skin of colour looks like. So the symptoms can sometimes be misread by people. So it's just really important to recognise that for patients and clinicians, that it can look and feel different, and that can be something which definitely needs to be addressed.
Anjali, did you want to comment any more about that?
No, I agree with all of that. I think that the big issue with skin of colour is the pigmentation concern can often be just as distressing as the primary skin condition itself as well. So it's just making sure that when we run through our treatment plan, we're very clear as well that we're doing this to stop you getting further issues of pigmentation as well. And I think that can also improve adherence to treatment plans when you physically say, yes, I have acknowledged the pigmentation there as well.
And sometimes there are misperceptions about the origin of the skin pigment change, can't there? There can be misperceptions about diet or other things. Is that right, Bernard?
Yeah, very much so. But I think layering on top of that is, if you are, the BAME community is, an umbrella term for many different communities within that, and also mixed culture, mixed heritage. I think each of them will have their own social context as to what pigmentation means, and what cultural solutions there are. And I think I'm still learning about it. I feel like we're all still learning about it as a medical community as to what that means, and for different generations. So one generation will deal with pigment in one way, and another younger generation may deal with pigmentation in another way. Absolutely. And I think we that's the beauty of the job. I feel like you just always find new information.
Which is important for us to recognise as well, that we do learn from our patients and the people who come to see us. So, and we're very grateful for that, for that education that patients give to us. It's an absolute
honour to be part of patients' journeys and what we learn.
Okay, I'm going to wrap up, if that's okay, and say thank you very much to Dr. Anjali and Mahto for coming to join us today. Dr. Bernard Ho, Dr. Tess McPherson, and Dr. Eleanor Chatburn. It's been a real pleasure, and thanks very much to the British Skin Foundation for all of your input and for your drive to make sure that we in the UK and across the globe are getting the message that skin is not just about skin, it's also about the individual inside that skin.